Okay, I think I'm going to go ahead and get us started. Thank you all so much for joining us and taking time out of your Friday to learn some really important information about how you can get help or get help for your friends and family members who may be struggling during these challenging times. When we're in the middle of a hardship, sometimes it's hard to know who to turn to, but Tulsa Area United Way has been helping meet the needs in our community for almost 100 years now. And what's really important is to see how our mission is really coming to the forefront here during this pandemic. We are here to unite people and resources to improve lives and strengthen our communities. And now more than ever, we need our nonprofits to be operating strong so that we can all recover together quickly. I'm Krista Hemme, Chief Marketing Officer of the Tulsa Area United Way. And again, thank you so much for being here. And I want to go over our agenda very quickly because we have a wonderful lineup of amazing community leaders who are here to share with us their experiences during the pandemic. We have Pam Ballard, who is the CEO of the Community Service Council, who will talk about how people can request assistance. Pam joined the Community Service Council in February 2019 after leading the Susan G. Komen Tulsa and Eastern Oklahoma affiliate. Pam is a certified nonprofit executive and consultant and also holds a certification in human resource management. Tulsa Area United Way President and CEO Allison Anthony will discuss how the United Way is working to financially support our nonprofit partner agencies. Allison has both her master's and bachelor's degrees from Oklahoma State University and has completed several leadership training programs, including the Harvard Talent Pipeline Development Program. Karen Lawhorn, One Gas Senior Vice President and Chief Financial Officer, who is our 2020 campaign chair, will also share her insights. Becky Glico, Housing Policy Director with the City of Tulsa, will talk about the eviction crisis and what's being done to help. Becky develops and implements the city's affordable housing strategy. She is also the Interim Director of Housing Solutions, a nonprofit that serves as the lead agency for A Way Home for Tulsa. The Honorable Susan Savage will share how COVID-19 has impacted Northeast Oklahoma's largest health center system. Mayor Savage, Susan as we call her, was elected Tulsa's first woman mayor in 1992 and served our citizens for a decade and then became Oklahoma Secretary of State from 2003 to 2011. She now leads Morton Comprehensive Health Services as its Chief Executive Officer. Matt Hancock, Chief Operating Officer of the YMCA of Greater Tulsa, will talk about the Y's efforts to help students during the pandemic. They've been very busy supporting the community when it comes to the well-being of our children. And then we will answer your questions through the Q&A feature on Zoom, or feel free to place your questions in the chat anytime during our presentation, and we will answer your questions at the end. But first, we're going to hear from Brent Sadler, our Chief Community Investments Officer, and he's going to share with us the work that the Tulsa Area United Way does in our community. Brent?
Thank you, Krista, and thanks for everyone joining us today to learn a little bit more about the Tulsa Area United Way. As Krista had mentioned, since 1924, our role has been to rally our community through fundraising efforts to make investments back into our community, establishing a safety net of resources for its citizens, especially the most vulnerable. And our role at the United Way is to be stewards of that process. And we do that through volunteers and donors just like you. And we're very excited to have you with us to learn a little bit more about the United Way today in assisting our community. We do that work in three pillars. We make investments around education, health and safety, and financial stability. We invest in over 160 different programs within those three pillars, and that includes everything from prenatal care to hospice care, and some of the others you see with academics, family support, and housing, all across the gamut. Our mission, as Krista had mentioned, is uniting people and resources to improve lives and strengthen our community. We have three primary funding streams that we use in making the investments in the community. The one that most folks are familiar with are 59 partners that we work with on an annual basis. One of the things that I believe makes the United Way so strong, and why I've been involved the 5 years in my role and the 9 years prior to, is that this is a community-led and volunteer-led process. We use over 170 different volunteers and trainings with over 5,000 hours to vet the programs and the agencies on an annual basis. And in addition to providing the monetary support and funding investment support, we also assist with training consultation. We have some third-party backroom technology expertise that we use with many of our partners, and just work in collaboration with each other all the time. An additional funding stream that we have are what we call community collaborations. We have 8 collaborations that we currently fund, and those are agencies, backbone agencies that are designed to help move the needle on systemic issues within our community. So for instance, A Way Home for Tulsa. A Way Home for Tulsa is a project, program, initiative to help make homelessness rare, brief, and non-reoccurring within our community. And that group helps coordinate over 25 other organizations to remove the homelessness within our community. Another that you may be familiar with is Community Resource Team, CRT, where the police and the fire and mental health experts in our community are together on a day, 3 times a week, and they're responding to mental health calls within our community. It allows our police to police, it allows our fire department to do the work that they do well, and it provides for those wraparound services for our those in crisis within our community. The third primary funding stream that we have are the social innovation grants, and these are ideas that we want to incubate in our community. They're a 1-year grant. We encourage those innovative funding ideas and create testing new approaches to make a change within our community. Another that's just announced, I believe yesterday, was through our COPES and Family and Children Services. We will now have someone embedded at 911 to help answer those citizens that are in distress. They'll immediately be able to receive the assistance from a mental health standpoint versus being passed from 911 to another call. It will immediately happen. And that is the result of an innovation grant that has occurred over the last few months. So those are the 3 primary ways of funding. But we also at the United Way help with crisis response. With the school closures in 2018, food security for our children is always a major concern in our community. But when the schools are not open, it's especially concerning. We were able to bring many different groups together to help secure food for those children. Last year, floods and tornadoes, along with our partners with the Tulsa Community Foundation, able to support many of our citizens involved there. And certainly with the 2020 pandemic, we were able to put together a fund to assist our individuals and families that are most in distress with basic needs, rent, utilities, and food within our community. So other ways from just a funding stream standpoint that we're able to support the communities through crisis response, such as we are right now. We also provide professional development and service for our partners and for the community. Again, I mentioned community investments panels. This is a way that you can become involved with us in looking and vetting and looking at all the agencies within our portfolio. Our next Tulsa program is in its 7th year. That program is designed to incubate new executive directors within our community. New Voices is a program to increase the diversity of board membership within our community in the nonprofit space. InTech is the third-party IT assistance that we're able to provide almost half of our 59 partner agencies with that backroom supports so that they're not looking for that outside of individually. We can provide those supports. We have different affinity groups that you can become involved in. Women United, Emerging Leaders, Retire United. And annually, Tulsa and Tulsa Area United Way has one of the largest days of caring in the country. We have over 450 programs and over 5,000 volunteers that go into our community. This year, with COVID being a little bit differently, we've broken that up into 3 different days with a food drive, some technology drive, some resume assistance, and we'll also provide some of the traditional day of caring work later this year as well. But a lot of behind the scenes support for our partner agencies. We really try very hard to make sure that they're aware of, for instance, the PPP loans that were provided by the Small Business Administration this year. And many of them were able to take advantage of that, and just can't say enough with our partners and how they have managed through the pandemic. They continue to manage through the pandemic, and the work that they have done to sustain their agencies and to continue to provide the needed services in our community for all of us. So a little bit about Tulsa Area United Way. Krista, thank you for the time.
Brent, it's really hard to cover everything that the United Way does in just 3 slides, but I think you did a great job. Thank you.
Thank you.
211 is one of the many programs that Tulsa Area United Way supports and funds. And here to talk about how 211 Eastern Oklahoma helps meet the needs in the community is Pam Ballard. Pam?
Thank you so much, Krista. It's a pleasure to be here. So 211 is a 24/7 free helpline for Oklahomans. We take calls for the 37 counties of Eastern Oklahoma. And so we've been around for 15 years, and it's the way that we're currently set up. So as you can imagine, in March, we had a spike of about 600% in the calls we're taking. So this was through primarily a partnership with the Oklahoma State Department of Health. If you go to their website, you would think that 211 was their line, because it does say, call 211. So we started taking all those calls for people who needed assistance knowing about COVID, what the symptoms were, where you can go for testing. And that was in addition to all the other services that we have always provided for the residents in our communities that we serve. Something that I really want to stress is that 211 isn't for a certain demographic or someone in a certain economic condition. It really is for all residents, because anyone at any given time could find themselves in a situation where they do need the services of 211. So across our spectrum, we have about 1,200 we call resource partners. So these are faith-based organizations, community-based organizations, government entities, nonprofits, where they share their information with us, and together they provide between 6,000 and 7,000 different services that we can share information with people who call in. That's from utility assistance, rent assistance, employment opportunities. If you need assistance finding diapers for infants or babies, all of those types of services. You can call for yourself, for family members, for neighbors, friends, and we can provide that information to folks. So this is all free and confidential information, offering help and hope for our communities. So we have trained call specialists who can connect people to their need in the community and the services closest to them. So we provide the services by zip code. So we try and be very specific, and we try and have the most accurate information available. We spend a lot of money each year, well over $100,000 a year, to make sure that the information we're giving people who call, the most accurate information closest to them, because we know people who are calling do not have a lot of resources, and they can't be driving all over Eastern Oklahoma trying to find services. So we really try to be cognizant of people's time and the resources when we're giving them information. We do have bilingual specialists on staff, as well as we have availability for a number of different translations for people who call. 211 does fall under the umbrella of the Community Service Council. So we're very happy to be able to have 211 within our organization. And this is a really short video that we'll show just to give you a sample of some of the calls that we do receive. And I didn't realize that video did not have audio with it, but we do have one for that. We did that for privacy's sake. We do have one that we show to funders. It's a little bit longer than that, and it does have the actual audio with it so that you can hear sometimes the desperation in people's voices when they call because they don't really know where else to turn. And this is a place where they at least know that there's help and there's hope available, and that there are so many people in our community that they want to help. That's the primary reason for existing. That's why we're all here. That's why United Way is here to help as well, and they offer support to us. So just so far this year, we have made more than 258,000 referrals for services for Oklahomans looking for help in the areas that you see listed. So the number one request is for people needing help with utility payments, food and meals for their families, housing support, health care, legal resources, mental health, child care, COVID-19 resources, financial assistance, transportation, addiction support, employment resources, and so many more. I know that I have ran into a number of people just in the community, or I've been on a number of calls, and people say, I needed to call you to find, where we could find rapid testing sites for COVID-19. So again, 211 is for everyone. So whenever you're thinking about, you don't know who to call or where to turn for help, you know someone who needs assistance, and you're just wondering, where can I go? Where can I get this information? You're trying to search online and it's really confusing. Just remember to call 211. It's very simple, and you really can find so much information through our trained specialists. And there are 4 ways to reach us. Number 1, just call 211. You can live chat. If you do go to 211eok.org, there is a chat box in the lower right-hand corner. So you can go there and have live chat from 8 a.m. to 8 p.m. You can text. You can text your zip code to the toll-free number that is shown there, and you can text with one of our specialists, or you can go to 211eok.org. You can put in your zip code and you can search for the various services. So if you're looking for food or meals, you can put in your zip code, put in the service that you're looking for, and it will bring up the resources that are closest to you. So why call 211 instead of using search engines? And so I just mentioned this, and I actually found myself doing this when a member of a family, they were needing to look for a COVID test. And I thought, oh, I don't want to bother one of our call specialists. And so I tried going online to find a testing center closest to them. And it really was kind of a disaster. And so I finally did just give in. I thought I'm going to call one of our call specialists. And I was really so pleasantly surprised by the amount of information I received from them, in addition to why I originally called. So it was extremely helpful. And so it's a great testimonial for calling 211. It was so much easier than what I was trying to do by looking online. So how does 211 Eastern Oklahoma help during COVID-19? So we actually have so many more resources on our website, other than just where to go for a test and find, rapid testing or regular testing for COVID-19. You can find out, there's a map showing how many cases are in each county, and also by zip code. You can go and look at the map. It's for the entire state. Also, the COVID-19 resource page Also, it has a link to the Oklahoma State Department of Health. It gives you a number of resources about what are the symptoms of COVID-19. It has mask mandates for different areas across the state. So if you're wondering if you're traveling somewhere else and you need to know that, we have all of those resources. We try and update that daily so that you kind of know what the latest is. Community alerts, you can sign up for our text alerts and get those too on your mobile phone. We also have the Eviction Resource Center, so you can just dial 211 to reach us, or you can also text, chat, or visit our website. And so since March 15th, more than 100,000 people have called 211 Eastern Oklahoma, and there are the top 5 reasons they have called us. Again, utility assistance, food and meals, healthcare, housing, and disaster services. We're again 24/7. Holidays, weekends, 211 is available. Simply dial 211, live chat, text your zip code to 877-836-2111, or you can search online at 211eok.org. So thank you so much, Krista, for this opportunity.
Thank you, Pam. You know, I just love how easy Community Service Council has made it for people to contact you for assistance. It's just as easy as dialing 211. And if you'd rather text, there are options there for that as well. So Pam, thanks for sharing that information. And we're getting some questions about calling 211. We'll save those for after all of the panelists have spoken. So thank you for those questions. We will get to them. I'm going to turn it over now to Allison Anthony and Karen Lawhorn, who are going to talk about how Tulsa Area United Way raises money for our nonprofits so that we can make sure that the social safety net remains strong. Karen and Allison.
Thank you so much, Pam and Krista, Brent. That was a great overview and saved me some time, so that's wonderful. What was the number again? Just kidding. I think it's good. 211. We got it. And it is a great resource for our community, and you all have just been heroic in the pandemic. We're so appreciative connecting people and resources, and that's our purpose today, is to help you, anybody on this call, know how we're living that mission and how you can get help to your friends and neighbors. I think one of the things that Karen and I have been so struck by throughout all of our conversations is that this year community need really means your friend whose business might be struggling, or a neighbor who's lost their job, or a family member who's been who's had their income cut for whatever reason, and or had health issues. So we know we all need help sometimes, and that's why our mission is to connect people and resources to improve lives and strengthen communities. That's what we're here to do. And we know we need to live that mission, but we've also had to pivot. And I love that word pivot, because it signifies for me keeping one foot firmly planted. For those of you basketball fans, when you pivot, you keep one foot firmly planted, and we're doing that in our values and our mission, but we're also moving that other foot around and looking for new ways to be impactful and relevant and do meaningful work in this pandemic. You heard Brent talk about some of the ways we did that, raising $3.6 million with Tulsa Community Foundation, that were some of the first dollars out in this community. Some of the things we do behind the scenes, people aren't as aware of, like working with our 59 partner agencies. Many of them applied for with assistance and support from our team, and bringing together other resources. We received in the community $18 million that people could use up through July to keep their staff employed, when many of them weren't able to do fundraising or weren't able to do the things they normally did to generate income. And so, you know, that's money that's forgivable and stays right here in this community. And that crisis response is so important, additionally to things like setting up job boards and geomapping and resource pages that Krista and John Corey and their team have been so great at. So we also knew that we needed to continue looking forward, to continue raising much needed money that you heard is invested so wisely, because many people are going to continue. This is, you know, Chet Cadjo introduced me at Quick Trip a couple days ago, and he said, you know, this is the crazy woman that's taken on raising nearly $24 million in the worst economic times that any of us have ever seen. And I said, thank you for that warm introduction, Chet. But, you know, I just have so much faith in this community, and we know the need. We know the need was great. Last year, more than 500,050 times, over 500,000 times, someone accessed the resources of a United Way partner agency. And we know right now times are even tougher. We know that 1 in 3 kids right now are food insecure in our state. We know that in our state, 1 in 10 families are living below the poverty line. And for a family of 4, 1 in 10 people, but for a family of 4, that's $26,200. And 1 in 10 Oklahomans are living below that line. So we know we have a great need going forward. So we created online and all virtual tools and resources, things like this that you're participating with today. You can go online and look at our campaign toolkit and see more than 7 great videos to help you understand the work of the United Way. Most of all, besides having a great staff that did all that, we were so fortunate to have Karen Lawhorn, a great leader who was already lined up to do this work. We agreed no one really wanted to be learning how to navigate a big campaign in a pandemic, but she's just the right person for this time. So flexible, so tenacious. Karen Lawhorn of One Gas, we just thank you so much for taking on this task, this Herculean task or Amazonian task. And thank you for joining us today. Let's talk a little bit about the campaign and what you're learning. I know you've talked about the need to we put together an army of volunteers to help us. So talk a little bit about the response you got from people when you said, hey, I'm going to need help raising a lot of money this year in a pandemic. What'd you hear from people?
Thank you, Allison. And first, let me say thank you for the very kind words. But as you know, this is a team effort, and there's no better team than the team that you have assembled at the United Way. And I'm just happy to be along and to go where you tell me to go and do what you tell me to do. So in terms of reaching out and asking people to help us on the campaign this year, I was so amazed at the number of people who just readily said yes. You know, a couple of people, I sent an email and I said, can we have a conversation about, you know, seeing if you could help us with the campaign? And I got back, we don't need a conversation. What do you need me to do? So it's just amazing. And I think it tells that our community has such a belief in the work at the United Way and the leadership that the United Way has in the community. And I love how you highlighted, or the conversation was highlighted when Brent talked about the different sources of giving. We're not just raising money for partner agencies. We're raising money to help enable the United Way to continue to provide strong leadership in our community. And I think people recognize that. So these people have great concern for the community. They already have very busy jobs, but because they believe in what we're doing and they understand the need that's out there. So many of them readily said yes. And you know what? The ones who couldn't say yes helped connect me to other people who were able to say yes. So it was a great start to the campaign.
That's great. And I also know that they said yes because they like being on a winning team and they knew that you would be captain of a winning team. So I heard a lot of people say, how can you say no to Karen? She's gonna run a great campaign. I think one of the things that inspired me too, we spoke, you and I, to dozens of CEOs and business leaders as we prepared to set our goal. Tell us some of the messages that you heard from them that inspired you about their continued support of the United Way and the community, and what you heard from those business leaders.
Well, we heard the same thing from the business leaders as the people I reached out to and asked to work on the campaign. Gratitude for the United Way, gratitude for the leadership role that the United Way plays in the community, an understanding of the great work that our partner agencies do, and just a willingness to do what they can to help with that. We heard a lot of concern for the community. And, you know, the businesses that these CEOs run, they've all faced COVID challenges, but everyone on a different scale. In my own company, I'm very fortunate. We are an essential business. We have continued to operate while we've been impacted. We haven't had any layoffs. Our employees have continued to work. We see some of those companies. And then we also see companies who have experienced layoffs Their businesses have COVID has caused their businesses to just kind of disappear or be really adversely impacted. So we've seen all that, yet all of them are still optimistic that the employees who are still with them, the employees who have continued to have jobs, will also do what they can to step up and help the community. So I was left with just a very strong feeling of optimism that while this year is different, we may not raise as much money as we did last year. We are going to be successful in the campaign. This community is going to step up like it always does.
That's great. And Karen, I know that you and I also had fun on Day of Caring in our masks safely, but in the car together, driving all over the city for Day of Caring. And we got to see these amazing people pulling up, from a grandmother with one little bag of groceries to people pulling up with a whole truck bed full. Can you share why that was so moving in the way we pivoted to that Day of Caring?
It was so great to see. And again, the creativity of the team at United Way for coming up with this concept of Days of Caring this year, and this first kickoff event that allowed us to be safe and remote, but still to do something very impactful for the community. It was really great to see. Actually, I had to wipe sweat off my brow to see, the people, because it was really hot that day. But there's a picture of people that were standing out in the parking lot, all day long in 90+ degree heat for the United Way. And like you said, it was just wonderful to see all these people drive up, different walks of life, with just lots and lots of food and lots of encouragement for the folks who were out there and for the work that the United Way is doing. I think you've got the stats right here on what we did that day.
Right. We raised over 50,000 pounds of food in one day for this community from 15 sites, and we collected at 4 blood collection sites 155 pints of blood. And I think we were all in tears. You're going to hear from Matt here in a minute from the YMCA, but one of our blood sites was a YMCA, and we got a note that following week from a mom that said, I'm in tears as I write this because the blood that was given at this YMCA during Day of Caring is going into my daughter right now, who needs a blood transfusion, and without the work that you all did, we would be worried that she wouldn't have this opportunity to get this medical treatment. So, I mean, wow, that really made it real for us. So no wonder, when you have people that'll be hauling food around at near 100 degrees and know the life-saving impact of both the food with the kids, that I mentioned, 1 in 3 food insecure, and the need for blood. No wonder we're united in hope for a better future. So thank you. I want to thank all of you that are on this call. You can see why we have faith when people ask Karen and I, aren't you scared? Aren't you worried? When you're surrounded by this army of incredible people every day, from our employees to our volunteers, it's easy to have faith and be strong with your support. And you can also give. You can find out any of this information on our website. You can give, tauw.org. There's information about giving. There's information about advocating and communicating. Share our social media sites and from our social media sites and help us advocate and communicate, get the word out, and also volunteer. As you hear that we've got lots and lots of needs, and another opportunity coming up on October 9th for Day of Caring. So Karen, I just want to say thank you, my friend, for taking on this task. I know all of us on this webinar want to express our gratitude to you for your leadership, and we look forward to celebrating the success of the campaign with you. We're truly united and we're better together. Krista, back to you.
Thanks, Allison. Thanks, Karen. It was really inspiring to see the turnout of people and the donors who were pulling up in their cars and dropping off bags and boxes of groceries, and seeing how quickly those food crates were filling up. And that really gives me hope that we're going to raise the money that we need to raise for our nonprofit partners this year, because the community came out when we needed them. And I'm just really optimistic and hopeful that they will do the same for the campaign. As you saw, food is one of the biggest needs in our community right now during this pandemic. Pam mentioned food assistance and rent assistance as being one of the most requested issues for help. And to talk about that is Becky Glico. She's the Housing Policy Director for the City of Tulsa. She's hard at work trying to make sure that people get to stay in their homes. So I'm going to turn it over now to Becky.
Thanks, Krista. If we can go to the next slide. And actually probably the one after that, perfect. So even prior to the pandemic, Tulsa County is the 11th highest evictor in the country. And so we have over 14,000 residents of Tulsa County who go through the eviction process every year, which is staggering. And then couple that with the pandemic and the economic hardship associated with it, we knew that we needed to get rent assistance in place as quickly as possible once the CARES Act moratorium expired and to help people stay housed. And so in partnership with the Tulsa Housing Authority and Tulsa County, on August 24th, a rent assistance program was launched. And that also includes some state funds that are being operated by Restore Hope. I know that, similar to what Pam talked about with the ease of navigating 211, that was a goal that we had as well. We didn't want folks to have to go to different places to try to get rent assistance. And so we launched a one-stop portal, which anybody can access. It's tulsahousing.nanmckay.com. There's also a call center with agents who speak English and Spanish to help answer questions, help walk you through that portal. And right now, the current deadline to apply for rent assistance is September 30th, but we've just gotten word that that's now extended through October. So folks can still apply for rent assistance through October to stay housed, and we can pay up to $3,000 per household of rent assistance. Next slide. So far, we've had over 5,000 Tulsa County residents apply for rent assistance, totaling over $8 million in applications. But that means we also have about $8 million left to spend. And so I think people were worried, will there be any money left? Can I access it? There's absolutely funds available to keep you housed. And you really only have to meet and document 3 requirements. The first is that you have to have a COVID-19 related loss of income. And so that could be that your hours were cut, that you were laid off, that you were fired, that your daycare closed, and so you had to reduce your work hours, but it does have to be related to the pandemic. However, if you're not, if you haven't experienced that loss of income related to COVID, but you are still experiencing income insecurity at this time and you need rent assistance, there are some private funds available to help with that. This is something that both the Schusterman Foundation and the Tulsa Area United Way TCF COVID-19 relief funds have been really helpful with. So you can still apply. You do have to document that loss of income. You could do that with an unemployment letter. You could do that with just a letter from your current or former employer. You need a copy of your lease, and your landlord has to submit a W-9. And unfortunately, those last 2 requirements are federal requirements, so they can't be changed, but that's it. And you can do it all in the portal, and you don't have to scan anything in. You can even take a picture of your documents with your phone and upload those to the portal. So it's pretty straightforward. Like I said, there's also a call center that has fielded over 5,000 calls, and the average wait time is less than 3 minutes. So you can call, ask questions, and get help really quickly for your rent assistance. One thing, I know there's been a lot of questions that have come up since the government announced that CDC eviction moratorium. And so I know right now when you're thinking about the choice between rent or food or gas in the car, folks are asking, well, do I still have to pay my rent right now? And the answer is yes. So come January, if you haven't paid, your landlord can evict you and they can charge you for all that back rent plus fees. And so it's really important that even though there's a CDC eviction moratorium, meaning you can't be evicted right now for non-payment of rent, that you still apply for these rent assistance programs, because that way you won't be stuck with a bill come January. So biggest takeaway is go to tulsahousing.nanmckay.com or call the call center number and apply for rent assistance as quickly as possible. We're getting that process so that folks can stay housed.
Becky, thank you so much for that detailed information. It's been really complicated to navigate this pandemic because there are so many different programs, but this is really helpful. And to know that the application process has been, or application window has been extended to October 30th, correct? Yeah, so that's really great information to know. And we do have some questions regarding that. And again, we'll answer your questions regarding rent assistance at the end of the presentation. So please hang tight with us. I am now going to turn it over to Susan Savage, who is the CEO of Morton Comprehensive Health Services, and she's going to talk about her perspective and what's going on with healthcare during this pandemic. Susan?
Thank you, Kristen. I think what I will do is dive right into how healthcare facilities, especially community healthcare facilities, had to respond. We really at Morton went into an emergency response mode, and by that I mean I consolidated resources. We had to close 3 clinics, but I'm pleased to say no one has been furloughed, nor have we had to lay anyone off. But we consolidated our clinical staff because if you remember in March, at that time, the CDC was saying, we don't even think this is an airborne virus. We knew so little about what we were dealing with and what we were facing, who was affected. For example, I had several employees who were pregnant at the time. I moved them out of the front line just because wasn't sure what really impact, and our clinicians weren't sure whether or not there would be an impact on a developing fetus, how the virus was spread. PPE became a huge issue for us, and I absolutely, our ability to function and to keep our employees safe became paramount, and working with a number of foundations in the community and partners in the community, I would often be out on runs picking up a delivery of masks that came in from some source that we were able to utilize. Our patient services, we had to analyze those. What kind of services were essential to continue and what could we defer until May or June or later in the year, well checks, et cetera. Dental closed completely, optometry was closed. We saw a 60% drop in our patients in less than a month. People were afraid to come into a healthcare facility. Our transportation services, which the United Way funds and is an essential and core part of our service delivery model, dropped precipitously. We stopped our senior rides. We knew our seniors were very vulnerable. We stopped our social service route because most of those businesses or organizations closed. And we joined in a partnership with Meals on Wheels. And to date, we have delivered almost 40,000 meals for Meals on Wheels. That's since mid-April. We have driven about 12,000 miles to deliver those meals to homebound people. And Morton has donated approximately 710 hours of driver time. So we're continuing to look at how do we leverage what we do, who we are, and how we connect in the community with other essential services. I want to shift real quickly into what we are doing now, because I think that's very important, and also how we specifically address the most vulnerable, the homeless population. And Becky has been an important partner to us. We have been part of the 211 information network. We are a partner with the Y. Many of our employees used their services in the spring and through the summer for childcare because I couldn't let many of my employees go home except the essential service ones. We sent a lot of folks home and used telehealth and expanded telehealth incredibly. But specifically to the United Way, we have been the go-to organization for universal testing for all of the various shelters, the Day Center, Salvation Army, John 3:16, the Tulsa County Shelter, the Tulsa Overflow Shelter. And we have provided for those shelters, and you're seeing here a lot of our employees because I can't show you patients because of HIPAA. So I've got a lot of employees that you're looking at. But we have undertaken hundreds of tests, especially for our homeless population at our Midtown clinic. And from that, We have also ended up testing many of the staff members at these various shelters who had an exposure at various places, but we've used our transportation system. We've pivoted, to use Allison's word, from the social service route to providing transportation for those in need at the various shelters to come into the clinic, even from the encampments to come into the clinic. And so our focus has been this very vulnerable population that we serve. How do we expand and ensure that they are getting the same level of quality service that the rest of the folks in our community are receiving? We were fortunate early on to qualify for a PPP loan and some CARES funding, which has enabled us to offset the cost of our COVID testing, screening and testing. Since March, and I've got some statistics here, so pardon me while I look at my sheet. Since early April, late March, we have provided nearly 700 rides to individuals who are experiencing homelessness. We are continuing to deliver for them their discount prescriptions, whether they have to come here. For a while, we had a drive-through pharmacy instead of, again, bringing people into the clinic. We've transported folks to City Lights Hotel for quarantine and to the Tulsa Health Department for chest x-rays. Transportation continues to be a tremendous barrier for this population and throughout the community for access to medical services. So we're providing more than 1,000 rides, and we've just started this back up to seniors to nutrition sites. That was just immediately in the few months prior to the shutdown for COVID. So we're starting that back up, but that gives you an indication of how important this transportation system is that the United Way helps us offset the costs of providing. We can ensure that those folks get access to services. And of course, we are continuing our partnership with Meals on Wheels and looking to assist them with some ways that they have identified that they are interested in expanding medical services for their homebound clients. Moving forward and looking forward, I think it's important to know people have been afraid of coming into a healthcare facility, but I will tell you that we have had, and I can count on one hand the number of infections we have had among staff, and those have been traced to outside sources, not within the clinic. We have had no patient to staff transmissions of the virus. We have had no staff to staff, and we have had no staff to patient. So infection control protocols have been expanded and followed in the most rigorous way. Everyone who walks into the clinic is handed a mask. Everyone who gets on a bus is handed a mask. We've put up protective screening for our drivers. They're disinfecting the buses every day because it's important to us that our patients who come into the clinic or individuals we transport have a level of confidence in the measures we take to ensure their safety. We're even now undergoing a space reconfiguration plan in our main health center to accommodate a different kind of patient flow. We don't think, let me say that differently, we do think that we'll be in this situation for a long period of time, and these are practices and protocols that we will benefit from changing anyway. Flu season is upon us. I had my flu shot today. Morton provides flu shots at no out-of-pocket cost to folks. We will be undertaking a major flu shot and prevention initiative with our homeless population as well. We're getting some additional testing equipment, again funded through the CARES grant, that will allow us to eliminate flu, strep, and certain kinds of SARS viruses, so that in the event someone is still symptomatic, we don't have to wonder what it is. We can then test them, do a nasopharyngeal swab for an actual COVID test. So we're trying to deal with what we know are going to be some very significant and changing circumstances moving forward. Perhaps the biggest growth we have seen in the last 6 months is in our mental health services, our behavioral health services. All of our providers have access to telehealth. We initiated that within the first 2 weeks of the pandemic, so that our, you're seeing one of my controller and her family working from home during the major part of the crisis. But telemedicine, telehealth, those continue to be for us a way to serve patients who are homebound, a way to serve patients who are at higher risk, and certainly for our patients seeking mental health services, it is an extraordinary way and is proven to be very desirable for them to get access to the services that they need. Morton is really a microcosm of all of the things Allison and Karen talked about and Brent talked about, the issues that a community finds itself in this situation in particular. We deal with hungry people, we deal with homeless people, we deal with people in need of shelter, we deal with an essential service of healthcare. I think over the next several months, as we begin to understand how Medicaid expansion is going to take place, that we will see that emerging as a real issue. I hope our community will continue to find themselves engaged in addressing. So that's a snapshot, Krista, and we are very pleased to be part of this safety net network and have worked extraordinarily hard. I'm very proud of our providers, our clinicians, our nurses, all of our staff here, because they have been here every day.
They are heroes, Susan, and please, I know you tell them thank you every day, but from us, please tell them, I know they're working hard, they're working terribly long hours, and it's exhausting. It's been relentless. This has been relentless since March.
There is, and I thank you, I will share that, but there really is a phenomenon, and those in the social safety net service field know it, of compassion fatigue. You wear out because you are so intensely focused on the needs of someone else. So I'm pushing people to take time off. We're trying to help accommodate families, our employees with children in school who have to do virtual learning. It's tough, but we know the support the United Way has given us, and it's been great. Thank you.
Thank you, Susan. Speaking of children and supporting our youth during this difficult time, I'm going to turn it over now to Matt Hancock. He's the Chief Operating Officer of the YMCA of Greater Tulsa. And Matt, please talk about the work you're doing to support education and youth in our community.
Yeah, absolutely. You know, Krista, I appreciate it a lot. A lot of the sentiment that's already been said. You know, we couldn't do the work that we do at the YMCA of Greater Tulsa without partners and without collaboration. You know, as Susan said, we had an opportunity to serve her employees as well as multiple other employer groups across the metropolitan area. I was having a conversation this morning, and I think this really tees up really what the work of the Y is about and the role we're currently playing. In 1923, the Arkansas River flooded, and there was a flood in West Tulsa. And as a part of that flood, that was when the West Side YMCA became to fruition. There was no West Side YMCA at that time. And that West Side YMCA was founded in a partnership with the American Red Cross. And it was founded to assist families and assist with an encampment for families in the Carbondale Red Fork area there of West Tulsa. And here we are almost 100 years later, and the YMCA is still serving West Tulsa in many different ways. And maybe it was a tent camp. Maybe it's, as some of you guys may or may not think about the Y. You think about health and wellness. You think about youth sports, swim lessons. The pandemic has done a lot for the Y, and one of the things it's done for the Y is it's shown us that we as a big organization, I say a big organization of almost 600 employees in Tulsa and the metropolitan area, we've been pretty nimble. The ability to know that business as we knew it was disrupted there in mid-March. Kids going to school, kids not going to school, Ys being open, Ys being closed. And quickly where we found ourselves was we found ourselves filling gaps. We found ourselves feeding families. We found ourselves partnering with Bixby Public Schools, found ourselves partnering with all the local school districts to ensure that kids had food, partnering with other organizations to ensure that kids had school supplies so they could finish their virtual learning at home. As well as we hosted a YMCA Healthy Kids Day that was a virtual Healthy Kids Day where we actually went and we delivered soccer balls to families' homes to provide those kids that we had already been serving between the hours of 3 to 6 every day. We distributed about 1,500 soccer balls and different packs of school supplies to our kids, our Y kids that have been participating in programming with us during after school in our YMCA Go Club that fills that educational gap. The second week of April, we had an opportunity due to the CARES funding that Allison spoke about, as well as TCF, and the very generous donors in our community, the opportunity to serve our community in a very different way. And that was to be literally one of, I don't know of anybody else that was doing it in a formal method, but we started offering childcare the second week of April out of our Tandy Family Y and serving first responders, medical professionals, as well as essential workers that just frankly could not find care. We were able to turn nobody away to the inability to pay because we had that generosity of the United Way and generosity of our donors here in our community to ensure that that gap was filled. So families could go to work at Morton, families could go work at University of Oklahoma, St. Francis, police officers and other medical professionals, firefighters, they had a place to put their kid and they had a safe place where their kid could be at. You know, we have all the PPE based needs and things like that come across, and it came across initially. But one thing we had is we had great partners in those medical professionals that helped us learn along the way to ensure that we were keeping children safe, keeping our staff safe, and at the end of the day, meeting a community need that was necessary and real at the moment. Throughout the summer, what we found as we've been running programming since April, like I said, running summer camp, and then as we start transitioning back to school, we saw a lot of school districts reach out to the Y and ask, how are you doing it? What are you doing? And frankly, the answer was, we've got a lot of great resources, and there's Ys across the nation. There were, I think, close to 600 YMCAs across the nation that were offering essential childcare for families and workers. And we were one of the first, us in Oklahoma being one of the first states to actively engage in childcare. And so the resources Y to Y, the resources reaching out to the United Way and saying, hey, we've got a gap here, reaching out to Family and Children's Services as a program partner of ours. We had a lot of opportunities and a lot of unique opportunities to fulfill this need. As we've transitioned into the school year, we are running what's Graduate Oklahoma, and that's our signature after school program. Graduate Oklahoma looks different now. Graduate Oklahoma is kids that are at school at the Y. We've taken a pretty significant stance in the past that we want to get kids on their feet and get them moving in the out of school time environment. Well, school's now happening at the Y. So you walk into the Y and you see kids in our spaces at our facilities on a computer, sitting down, getting their lessons and their Zooms in, whether that be in Bixby, Owasso, TPS, Broken Arrow, Jinx, whichever district that may be. We have had that opportunity and have been filling that gap. Allison alluded to the blood drives. I think that the sentiment from that mom about blood products is the same sentiment we're getting from families here when it comes to Go Club. We have parents that have to go to work. They have to have a place where they can leave their child and their child be safe and that be primary. But they also have to have a place where their child can get that educational support and those educational gaps filled. And we've been blessed to be able to fill those gaps throughout the pandemic, as well as in the future as we move forward. The YMCA is blessed. At the same time, we were notified this past Monday. I know there's a couple of local organizations as well as the Y. We were acknowledged as to be one of the recipients of the statewide Hope Centers. So the YMCA of Greater Tulsa will be running a Hope Center that if you've seen Governor Stitt and his wife announce some of the opportunities behind hope and the science behind hope that Dr. Chan Hellman here locally provides. We'll have an opportunity to serve a Hope Center out of the Tandy Family Y, as well as when Brent acknowledged the innovation grants. One of the innovation grants the YMCA of Greater Tulsa had an opportunity to support about 5 years ago with the Family Safety Center is a program called Camp Hope. We've been able to work with these families that have been affected by domestic violence and continue to work with those families through the pandemic with our partners and are excited here this month actually to start back on those face-to-face meetings. We've been doing a lot with Zoom and a lot of support services with those families, but to get those kids back in groups together at the Y and doing it in a safe manner where families have the support as well as the engagement that these kids are yearning for. These kids that we're seeing right now, there's trauma, maybe a pandemic, trauma, maybe abuse in one way, shape, or form. It may be food insecurity, but we're seeing kids that are yearning for time with other people and yearning with time with each other. And the YMCA has been able to do that in a very safe place, as well as I know other organizations in our community have as well. The YMCA does have space available. We've got those facilities that we're running programming out of. You can find out more at ymcatulsa.org. Everything we do is income based, as well as we're not going to turn anybody away to the inability to pay, and the opportunities as well for future funding with the Hope Center that can provide other safety net supports for our families in our community.
Matt, thank you so much. And you saw me probably shaking my head.
Krista, for me, you're frozen. I'm not sure if for anybody else.
Yes, she is.
Okay. I'm going to take over. Krista, we've lost you. You're frozen, but you look lovely. Sometimes people are frozen in an awkward position. You're not. I want to just, John, if you could put up the 211 slide before we close. I want to make sure that we get the questions answered. We've had a request for the 211 slide that shows all the ways people can connect. And also, Becky, if you're still on, the question is rental assistance available outside of Tulsa County?
It is. I put some links in the Q&A, I think, but I might have done that wrong. So rental assistance is available throughout the state. The portal that I shared with you is only for Tulsa County, but Oklahoma County has its own program, and then Legal Aid Services of Oklahoma is supporting anywhere kind of in the rural areas. And so you can go to either the Legal Aid Services of Oklahoma website, which is legalaid, AID, no E, OK.org, or I put also in the Q&A a link to the rent assistance for Oklahoma County as well.
Great, thank you. And Matt, I didn't mean to, since Krista was frozen, I think she was saying nice things about you. We too at United Way have turned our former Bailey room where we had meetings into the Bailey Learning Academy, where now we have kids coming too. And I just, I listen to the work that you and Mayor Savage and Pam Ballard and Becky all shared, how we've all pivoted. I use that term loosely because I was a terrible basketball player, but I tell you what, you guys today have heard from 4 of our partners, and there are dozens more. Remember, we have 59 partner agencies in addition to collaboration. The only way we get through this is to be flexible and to collaborate and work together, and you all are the gold standard on this call of those that know how to pivot and collaborate. And I'll just go back to reminding everyone about why our campaign is United in Hope, because we're talking about the real scientific theory of hope, which is that tomorrow will be better than today. And we all have a role to play in making that happen. And if we define our goals and set out the pathways and remove barriers, we can indeed do that. And so I would just be not doing my job if I didn't say one of the main reasons you can do that is to give to your United Way campaign, whether that's at your workplace or at our website, tauw.org. Join together with 30,000 plus other donors in this community that believe that together we can take care of that community in need. And this year, that community in need is somebody that you know. So I thank you all for being with us today. Krista and team, thanks for putting together an amazing program. I'm sorry we went a little bit long, but wow, that was a lot of information in an hour and 4 minutes. So thank you for living united and for being united with us in hope. Have a great weekend. Bye-bye.